Hi, this video is for strengthening exercises for the unstable or hypermobile cervical spine. And basically what that means is a neck that's just moving way too much, so way more than it should normally. Often these patients present with lots of headaches and, ironically, it feels stiff in their neck, lots of muscular spasm, and definitely a lot of neck and shoulder pain. So the very first exercise we're going to look at is called the chin tuck, and it basically strengthens the deep neck flexor muscles, and sometimes it's called the abs of the neck. So you're strengthening the ab, like a sit-up type movement, but for the neck. And basically this exercise is actually a retraction of the head, and it is called the chin tuck, but it's basically a translation of the head straight backwards. So what we do is chin tuck back, and just hold for a few seconds and relax. Back, hold for a few seconds and relax. Back, hold for a few seconds and relax. Now, once we've done our exercises for the chin tuck, we're going to move on to laying onto our back. We're going to add the chin tuck, and then we're going to lift our head slightly. So what we do is lie on the floor, we chin tuck down, and then we lift off. We hold this for 10 seconds and we can relax and repeat. So when you're lifting the head off the bench, really only try to lift off a few millimeters, and that will stop you from really going too excessively. So this would be incorrect, down and here. That's the wrong way to do this exercise. The final exercises for the hypermobile neck will be isometric strengthening in all directions, and all directions will be flexion, extension, lateral flexion, opposite lateral flexion, and rotation and rotation. And we're going to use our hands as the resisting force. So for flexion, we're going to push forwards for 10 seconds like this, right into your hands. You're going to feel this right into the front of the throat almost. Just like the chin tuck with the lift off technique, and then put the hands behind the head, and now I'm pushing backwards for 10 seconds again. Now what we're going to do is the lateral flexion. So here, lateral flexion to the right, 10 seconds, to the left, 10 seconds, and now think about rotating the head to the left, rotate to the left, 10 seconds. This one, rotate to the right, 10 seconds. So some people find that the isometric contractions are too difficult because they can't get their arm up to their head, they've too much shoulder pain or neck pain. So in that case, maybe you might like to use a pillow and maybe like a cervical roll like this, and basically you can put it against the wall, and then that can be your barrier, and that can be way more comfortable to do it that way than needing to kind of hold your hands up here like this for those isometric strengthening exercises. Okay, so hopefully that helps. There's 4 exercises for the hypermobile neck. So any questions, pop them in the comments below, and see you on the next one. Thank you.